Hey guys, it's Ivorie. Welcome back to my channel where I talk about all things from mental health and wellness to days in my life. If you are new here, then welcome. I am a clinical psychologist and I do make videos about psychology in order to make psychology, psychological terms, and mental health more accessible to people and more relatable. I am going to be answering some frequently asked questions about psychology, psychologists, and neuropsychology because I do specialize in neuropsychology. I did make a part 1 and part 2 about my journey to become a psychologist and neuropsychologist. So if you have not watched those videos yet, and you have questions about the journey or my journey specifically, then please check those videos out first and then come back to this video where you'll see me follow up on some other questions that maybe weren't addressed. So let's dive right into it. Set of questions is all about grad school and getting a degree in psychology. What is the most important thing to look for when choosing a school to get your PsyD? I would really say that it's really important to look for a good fit with that school. So there are some great schools out there, but just because it's a great school and it has a great reputation does not mean that it's going to be a good fit for you. So I would really think about what the professors there are doing, what their research interests are or their clinical interests are. Is there someone there who you think would be able to serve in the role as a great advisor or even a mentor? And it's a long 5 years. And so you do want to make sure that you are comfortable there. When you go on your interviews, how does the campus look? How does it make you feel? Does the faculty seem warm and inviting? Do the students seem warm and inviting? And also see how stressed the students say that they are and really ask them to be honest about their experiences. One of the schools that I got accepted into and I ended up choosing not to go to, a big reason why I chose not to go there was just because of the vibe that I felt on campus. I did not feel like it was warm or welcoming. When I talked to the students, they told me that yes, it's a 5-year program, but hardly anybody ever completes it in 5 years because that program is actually called the suicide track. So there was no way I wanted to go there. Do you need a certain GRE score to get into grad school? I would just look at the school's website and see if they say anything about their acceptable GRE scores and GPA. Also, there's a book that's put out by the American Psychological Association. It lists all of the schools in the country, and you can go through and see what their acceptance rates are, what they require as their minimum GPA and GRE scores, and then you can go from there. Should I apply for a PhD or a PsyD program, and what's the difference? So at the very basic level, the difference is how much clinical work versus research you are involved in the program. So PhD programs tend to be more research focused, whereas PsyD programs were developed in order to focus on clinical skills. No matter what program you go to, you're going to get great clinical experience. But if you know for sure that you want to be a researcher, I would definitely say that you should apply to a PhD program. That does not mean that you cannot do research if you go to a PsyD program and get a PsyD. Now, something that is related to that is funding. So people always ask, how much debt are you in? Which I'm not gonna say that. And also, is there funding available? So if you can find scholarships, I would definitely do that. A lot of the PhD programs, because they are so research heavy, they have grants available. And so some of the programs may be able to cover your tuition, or you get a stipend, or you get some kind of funding for that because of all of the research that's going on there. To be completely honest, don't know the rates of funding for PsyD programs, but they are much less funded. Now, a lot of the PhD programs tend to take smaller cohorts, so they do tend to be a bit more competitive. I'm completing my undergrad degree and I was intending to go to med school, would I be able to get my master's in psychology? So I guess basically the question is, if you don't major in psychology, can you still be a psychologist, or is it just a lost cause? I know a ton of people who did not major in psychology and still went on to get their doctorates in psychology. I know people who had completely different careers first. They were teachers, they were nurses, and then they went back to get their doctorate in psychology. So if you didn't major in psychology in undergrad, you can still get into a graduate program. There are courses that you could take if you feel like you need to get those basics and you didn't get them. A lot of the schools may require you to take the psychology portion of the GRE in order to get accepted into that school if you did not major in psychology. No big deal, you can definitely still do it. Should I get my master's before applying to doctoral programs? And a similar question is, I did not get into any doctoral programs, but was offered a place in a master's program. Should I take it or wait to apply again the next year? So this is something that I can't tell you 100% which way to go. Some programs do actually require you to have a master's degree first, but for many programs, you just get your master's along the way. So if you already did a separate standalone master's program and then you enter into this doctorate program where you get your master's along the way, your credits and all of that work that you did throughout your master's program may not actually apply or get you any less time in that doctoral program. So for example, in my program, we did have a lot of us who came straight out of undergrad or took a couple years off. And then we did have people who got their master's first and then came back. And we all still graduated at the exact same time. We all still went to the master's ceremony and they just got a second master's. On the other hand, if you did not get into any doctoral programs and you were offered a position in a master's program, or if you just want to get a master's first, I don't think that there's anything wrong with that, especially if you're thinking that it'll give you more experience and make you more competitive to get into a doctoral program. And especially if you can get it for free. Like if you have funding to do it, then sure. I think I maybe would have tried to get an internship or a research opportunity in that year between undergrad and reapplying if I hadn't gotten. How did you, and then me, find mentors and collaborate with others? So I'm gonna be completely honest and kind of transparent in talking about this. So I did not find mentors. Part of that is because I just never established really great relationships with people who I felt really comfortable with. There's a lot about going through the field of psychology and establishing yourself as a professional, networking, building connections that is really important and that is not taught in school. There's also things like research opportunities that having a mentor could expose you to, opportunities to be on different committees and things like that. Like you can have a mentor for a number of different reasons and point you in a number of different directions. And having that person is really important to have that kind of guidance. And it really honestly makes the process a bit smoother. So having a mentor is something that is really important, and I encourage you, if you are in this field, if you are in academia in any way, I do encourage you, even if you're, whatever your job may be, whatever you're in school for, whatever you're doing, get a mentor. That being said, I do not have a mentor. And kind of as an aside, this is something that is really important for people of color, is to have someone who is your mentor, who has also navigated this field as a person of color and who is able to give you some guidance in that way. Anyway, that being said, didn't have one, but here's how you can get one, and I do encourage you to do it. So you can find a mentor through different groups. So APA, again, the American Psychological Association, has multiple divisions. For example, I am a member of Division 40, also known as the Society for Clinical Neuropsychology. A lot of those different divisions do have opportunities for getting a mentor. I would check out those different divisions, see if they have listed something on their page about mentorship, or just email whoever's head of that division and ask them, are there any opportunities for getting a mentor within this organization. Another way is that it can really just happen organically. Like your advisor could actually become your mentor if you establish that kind of relationship. A different professor who you have been working with and you feel a connection with could become your mentor. You could meet someone at a conference and you guys really kick it off, and then you continue communication with them and they can become your mentor. So it can kind of just happen organically. And then sometimes mentorship opportunities happen if you just email a person within the field. It's a bold move, but if you are bold enough to email a person in the field who has similar interests as you, or who you are really looking forward to following in their footsteps or working with them, or just getting some expertise and guidance and kind of just absorbing all of that, if you just email them and, just say, hey, I would really love to connect with you. I love your work on blah, blah, blah. I'm interested in blah, blah, blah. Would you be willing to chat with me? You could establish a mentorship in that way. Another question that I got on Instagram from a friend, Allison, is how do you manage to force yourself to do burpees while in grad school? And basically, how do you take care of yourself while you're in grad school or in postdoc or at whatever stage you may be in? I'll be honest, I did not always take care of myself. One of the biggest things is to really divide your time out and decide what's really important to you. Personally, I'm really into fitness and I actually really enjoy exercising. It's a great stress relief. I encourage you all to do it, whatever makes you feel good. So that was something that was really important to me, and I wanted to prioritize time for it. Even in the midst of being super exhausted from school and saying, I don't have time to do this, if I could find 5 or 10 minutes to go for a quick run or to do a quick yoga session, I would do it. Again, didn't always happen, but when I was on it, I was on it. One trick that you can do to train your mind to be really dedicated with this is to set a goal for yourself. So throughout most of grad school, I signed up for Spartan races, and signing up for those Spartan races gave me something to train for. There was a goal, there was a light at the end of the tunnel. I knew that on July 18th, I would be running this race, and I did not want to look a fool going out there. And so I set that as my goal in order to train for it and to hold myself accountable. So the next couple of questions are for neuropsychologists specifically. In order to be a neuropsychologist, does your program have to have a neuropsychology focus or track? And do you have to be in a clinical psychology program? There is a such thing called the Houston Conference Guidelines. As neuropsychologists in the field, we really hold to a high standard in order to say that you have met the criteria to be a neuropsychologist. So within those Houston Conference Guidelines, they do talk about the level of education that you need to have, the basis of education, and the experience that should be required in order to practice neuropsychology. Neuropsychologists do go to clinical psychology programs. They do have the basis in that. So the Houston Conference Guidelines, I have them pulled up right now, and it has multiple different sections. One of the sections is knowledge base. So of course there's generic psychology, foundations for the study of brain-behavior relationships, which is neuropsychology, and then also foundations for the practice of clinical neuropsychology, which is specialized neuropsychological assessment techniques, specialized neuropsychological intervention techniques, research design, professional issues in neuropsychology, practical implications of neuropsychological conditions. And so basically, all that to say that there are courses that you need to have as the foundation in order to be a clinical neuropsychologist. Would you be able to get those courses if you did not go to a program that had a neuropsychology track or focus specifically? yes, there are outside courses that you can take outside of your program and still get that knowledge base that you need. So let's say you didn't realize you wanted to be a neuropsychologist until your third year in the program, and your program does not have that neuropsychology specialization. You can still get an internship and practicum experience in neuropsychology. You can still take outside courses to get that basic foundation of coursework in neuropsychology. When you get into a postdoctoral program, that needs to be 2 years, and it needs to be a focus on neuropsychology. That also includes didactics to further your knowledge and your training in neuropsychology. So yes, you can still be a neuropsychologist if your program does not have that track, but it does require some extra work on your behalf to get the coursework that you need, to get the internship that you need, to get the practicum experiences that you need. And if all else fails and you don't get any of that, you can re-specialize in neuropsychology. I know some people who came back to our program in order to re-specialize because after they got their doctorates, they decided, I want to be a neuropsychologist. And instead of going out and practicing without having the real knowledge that they would need to in order to practice competently, they did the very responsible thing of re-specializing. And so that is also an option. But I do also want to share with you, and I'll put it on the screen, that they're in the Houston Conference guidelines. They do have this very interesting chart here that just shows the amount of experience that people would typically need to get in order to be competent in their doctoral program, at internship, and residency. And the two different charts are for one, an individual who acquires some of these areas primarily at the doctoral level, and two, an individual who acquires some of these areas to a lesser degree at the doctoral level and a much greater degree at internship and residency levels. So again, if your program does not have a neuropsychology track, all is not lost. You can definitely still get that training and knowledge base at the internship and postdoc levels. The next question is, do you work alongside neurosurgeons? I have. For example, on internship, we had an inpatient epilepsy unit. And so we had conferences where we would meet with the neurosurgeon, the neurologist, the neuropsychologist, kind of everybody that was a part of that treatment team in order to decide the best course of care for those patients. Same thing when working with Parkinson's disease patients who are thinking about getting deep brain stimulation surgery to help control some of their symptoms. There are treatment teams where I've worked alongside with the neurologist and the neurosurgeon. And so, yeah, I mean, that's definitely an opportunity depending on where you are and what exactly you want to do and what treatment teams you're a part of. Shout out to one of my Instagram followers, Honey Wildfire. She submitted the next two questions. So shout out to you, girl. Thank you. One is, what are the gaps in neuropsychology related to diversity and support for Black people? And oh my God, I could talk about this all day. So I would say, just like many other fields, a lot of information that we have about people is based on a primarily white sample. And so we do need to do a lot of work to include African American and other minority individuals in our samples when we are conducting research and when we are establishing new tests and establishing new normative data. We want to be able to best capture those differences so that they are representative of the patient population that we are serving. As far as gaps related to diversity within psychology, as in students and practicing psychologists, we've definitely done some work within our field in order to increase representation of minority communities. However, there is a lot that still needs to be done as far as getting minorities into the field of psychology and into the field of neuropsychology. Some things that really great people in the field have been trying to do are to definitely improve that pipeline of getting information out about this career early on, so in middle school and high school and undergrad, and really establishing mentorship programs and internship and kind of summer training programs in order to get minorities more exposed to the field, and to feel like, yeah, I can do that. That sounds like a really cool thing to be a neuropsychologist, and I want to do that, and I believe that I can do that. There have been talks about getting programs in place in order to provide additional funding. And I really hope that we can see that through and to establish multiple programs where it'll make it easier to get information about psychology and neuropsychology specifically out there to more people of color, and to provide funding opportunities, because that does serve as a big barrier. And she also asked, what are some of the struggles that you face as a Black woman in neuropsychology? One of those struggles, I would say, is similar to, I think, a lot of professional Black women, is just our patients or our clients, maybe even some of our co-workers, assuming that we have a lesser role than we actually do. So sometimes I have gone out to get a patient and they thought that I was the nurse, or they thought that I was the psychometrist, even though I introduced myself as I'm Dr. So-and-so. They kind of ignored that part and just assumed that I was not the person who would be evaluating them. I did have a patient straight up say to my face that I was expecting you to be white. So you do sometimes get people who don't want to see you because you are a woman and you're a Black woman. It's really important to have guidance, and kind of here again comes the importance of having a mentor and someone who has kind of gone through that and can talk you through, wow, that sucks. Here's how we can address this. Here's what you can say to that person. I had some phenomenal attendings who just would not put up with that and let those patients know that we don't tolerate that here. She is very competent at her job and is very competent to evaluate you. People making you feel like you don't belong. And it's really important to know that you worked your butt off to get here. You do belong. All right, that's it for today's video. Thank you so much to everybody who submitted questions for this video. If you do have more questions about being a psychologist or being a neuropsychologist, that journey, what I do day to day, what all of that looks like, then please leave them in the comments below. And if there are enough questions, then I may make a second video like this in the future. If there were questions in this video that you feel like I didn't fully answer, then also let me know and we can chat about it in the comments. Thanks so much for watching. Bye.